If you only look at one aspect of the pillar in this problem, you don't solve it. So if you only focus on the human health side and you're like, okay, we're going to treat the water, which is the primary intervention of the study, but it's not that we're saying that that's the only intervention that's going to work. We're doing it to prove a point. We're doing it to prove that there's illness coming from groundwater. But if you just say we're going to treat well water with UV light, okay, solution solved. Well, that doesn't really solve it for all. Like, you need a policy framework to be able to then bring UV light into everyone's house. So that then involves like social scientists and political scientists and like policymakers, and that's a more complicated problem. Then if you look at the environmental health part, well, the environment's still continuing to get contaminated by septic systems if you don't come up with a new solution. There's multiple pathways to ultimately solve the problem, like completely, and like put a stamp on it that we've got this nailed. So if you want to come up with any reasonable solution to propose, you have to kind of deal with all, because if you only deal with one and that fails, then you haven't solved the problem.